Hello friends, this is Dr. Gayatri Patel, visiting faculty in the Department of Psychiatry, MLD MHI. I will be trying to answer the question, what are the techniques which help to prescribe in common mental disorders of anxiety and depression? It is a tricky one, but we are often time pressed in our busy practice, so we can use certain techniques to relieve the patient. Of course, a long case is mandatory later on, but when the patient comes to us, the certain techniques can help. One is observation, so we observe how the patient behaves, the way he talks, the way he's groomed, and each of this observation actually sometimes leads us to a rubric. The other technique is to divide all the symptoms into emotions, intellect, and behavior. When we divide it, we get to understand two things. One is the depth of the illness, and second, certain characteristics will also emerge. Now, those characteristics can lead us to either a group of medicine or a remedy, and which can relieve the patient temporarily. For example, when we see a patient who is very restless in the clinic because of anxiety, it may lead us to arsenic, which can be confirmed and prescribed. In the same way, in cases of low mood or depression, when we have patients who are completely reserved and reticent in behavior, and the attendant does say that he does not talk much, which is the behavior, and he is just quiet and withdrawn, drugs like natrimur can be confirmed asking other questions. So this is how we can proceed to relieve the patient and later on take a long case. This is not a simple thing. So we are going to have a lot of cases in the series which will answer many of your questions. But this is one of these are the few techniques. And a mental state examination is mandatory. So when we do the mental status examination, it gives us an idea about the depth of the illness, which we are going to handle in the future. So thank you, friends. Please go ahead and see the series where many of these questions will be answered.